Times story. Leaning forward, MSNBC loses ground to rival CNN. Yet another record drop in MSNBC's viewing figures, and that applies also to CNN, Fox News, across the board. Rachel Maddow, the biggest star on the MSNBC cable network, just posted her lowest quarterly ratings results ever. Morning Joe, MSNBC's signature morning program, scored its second lowest quarterly ratings, reaching an average of just 87,000 viewers in the key news demographic group. Now, David Knight, I made a video on Friday, a 3-minute video about The Simpsons supposedly predicting the Ebola outbreak back in 1997. Of course, you know, I debunked it. It was complete nonsense. But that one video got more views than MSNBC's signature morning program in their key demographic does each day. What does that tell you about the decline of the mainstream media?
Yeah, kind of beating them at their own game, I guess. You know, we have a lot of news that goes up, and just look at the talk radio audience. For us, for other talk radio hosts, it dwarfs in any given moment their highest ratings. So yeah, people are not looking for that. It's kind of like what you see with the currency going on in Venezuela. You've now got a Bitcoin interest in Venezuela because they've had currency controls on there. We've had information control, and people are hungry for authentic information. They want to hear real stories that aren't filtered, that aren't spun, and they're not going to hear it on MSNBC. They know that.
So obviously Venezuelans turn to Bitcoin. Tell us, I mean, we've heard stories about rationing of toilet paper in Venezuela. How are they using the cryptocurrency to get around those government control measures?
Well, yeah, you know, earlier this year, Bloomberg did a piece. They were talking to bond investors, and they said, Venezuela is a great place to invest. We've made nearly 700% return on our investment under Hugo Chavez. We don't expect it to change under his successor. That the people, the leadership in Venezuela understands that their first responsibility is to pay off their debtors, okay, their sovereign debt. At the meantime, in that article, they're pointing out how the Venezuelans are having to go to neighboring countries to get water, to get medicine, to get food. They didn't have basic necessities. I mean, it was beyond even toilet paper. So they've also had currency controls. And in this article from Reuters, it says 2 New York-based Venezuelan brothers are hoping this week to start trading on the first Bitcoin exchange in Venezuela. They say they've already got several hundred Bitcoin enthusiasts there. So, you know, it's kind of one way. One of the advantages, of course, of Bitcoin is to be able to transfer your money from one jurisdiction to another. And that's getting increasingly difficult, even in Western countries with currency controls, to get your money out of a given country because they just don't allow you to transfer it in the conventional banking system. Of course, you can't carry it with you. You'll get it stolen by the law enforcement at the airport, if nowhere else, you know, because they have the asset forfeiture laws, which are not really laws, they're not legitimate laws. But basically, if they merely assert that they think that that currency that you have with you is illegitimate, they are entitled, according to their policies, to keep that money and to keep the proceeds of that money. And of course, that's a major part of what's driving the war on drugs, as well as the militarization of the police. They're using that to buy some of the things that really, in my opinion, the police have no business owning.
And we're going to go to your calls shortly as well, 1-800-259-9231. But David Knight, you had another story about apparently the Ivory Coast has better security measures in terms of fighting Ebola than the United States, it seems.
Yeah, it turns out that we're coming up to the chocolate harvesting season in the Ivory Coast, and there's a lot of stories coming out now to expect a price increase on chocolate because the Ivory Coast has decided that they're going to close their borders because they're concerned about Ebola, and they're heavily dependent on migrant workers to come in from the countries that are currently being affected by the Ebola pandemic. They are dependent on those migrant workers to come in and do the harvest. But you have a third world country like the Ivory Coast that has the will as well as the ability to close their borders. If they didn't have the ability to do it, people wouldn't be concerned about the price going up. But we don't have the will to do that. We certainly have the ability to do that. We certainly have the ability to contain those countries. And the measures that we see with the thermometers and that's just nonsense. And everybody knows that. That's one of the reasons why people are not paying any attention to the mainstream media, because mainstream media is just parroting back what the CDC and the government officials are telling people. And quite frankly, their first priority is not to protect the public, but to keep the borders open.
It seems this, they're trying to save face. I mean, it seems it's too late now to block the flights, because if they did so, they would have to acknowledge that it was a mistake not to do so in the first place. And now we have, as we saw before the break, Dr. Eileen Marty saying that she came back from Nigeria having been potentially exposed to Ebola and received no checks whatsoever. Maybe we could forgive the CNN reporters a week or two ago because those measures weren't in place, but now they are in place. People are still returning from Ebola-hit countries and not receiving any checks. Not that those checks, David Knight, would really have an impact in the first place. Isn't the only solution to block the flights?
I don't think they are in place, Paul. I mean, we keep hearing from Obama and from officials that they put these in place, but everybody that's coming through is outraged that absolutely nothing is being done. I mean, they're still asking people if you're bringing in tobacco or alcohol so they can tax it, but they're not interested if you're bringing in Ebola. They could care less. They are not doing it. They're simply lying to the people. We're seeing this at every level. We've seen at the presidential level, at the state level here in Texas, and at the local level with Judge Jenkins. All of them are saying there's absolutely no risk. It's not coming to America. It's not going to get out of this one patient who has come down with it, and now we've seen it spread to a second patient. They continue to tell people things that aren't true, that I believe that they know are not true.
And here's an interesting story out of Breitbart. Texas governor's office takes over Dallas Ebola apartment cleanup. Now we know that this was basically botched in the first place. We had the image of the guys with no protective gear whatsoever pressure washing the Ebola vomit off the sidewalk where patient 0 went to the hospital. Eyewitness reports said that he vomited all over the sidewalk. They were there pressure washing it with a hose, no protection whatsoever. Then, of course, you had the sheriff's deputies who were forced into the apartment. One of them got ill. Thankfully, it turned out that he didn't have the Ebola virus. But now the Texas governor's office has taken over the cleanup of that apartment. David Knight, we were told days ago that this cleanup with the hazmat crews, as you see there, had already taken place. And yet, apparently now it's being handed off to somebody else.
They're waiting days to do this. And as a matter of fact, the company that cleaned up Mr. Duncan's apartment, or the apartment he was staying in, they took their precautions to a level above what the CDC was telling people. So clearly they did not believe that. They didn't want to take the chance. And that's what we should be doing. That's what we should be demanding that our officials do, that they go an extra level with this, an extra set of precaution, because clearly they don't understand how easily this is being transmitted. We've had now 2 nurses in Western countries that have come down with it. That's what we said from the very beginning. It was Alex Jones and InfoWars saying this is violating your protocols, and we had medical people that were saying that as well. We weren't the only ones who were saying it. You're violating your own protocols, bringing people into this country to be treated. It's too easy for it to get out, and now we've seen that happen twice in just a few cases. There's only been 5 people, I think, that have been brought into the United States, and now we've had one of those cases that has transferred to a medical professional. We've seen hundreds of medical professionals in Liberia and Sierra Leone die from this. So clearly there's something about the protocols, as careful as they are, that are not 100% certain, and maybe it's modes of transmission that they don't fully understand. When I was on the radio yesterday, I talked about Nancy Wrightball, who was one of the first 2 people that was brought back to Emory University along with Kent Brantley. She said she had no idea how she had contacted it. She said she was not even in the hot zone. She was helping to decontaminate the people who, the doctors who were in the hot zone, and she was very careful. She knew she did not touch a fellow coworker who had Ebola. She said, perhaps I touched something that he had touched. But see, we're getting exactly the opposite message from Judge Jenkins when he makes a point of saying that he proudly went into the apartment and hung out with these people and then drove them 45 minutes to a new home. Now, I think what he knew or was told is that after several days, the chances of a virus not being transmittable, still being alive, goes down to nearly 0. But it is, you can never say with something like this that there is 0 risk. And that's what they've been telling everybody. It is not a 100% chance that you're going to get it or a 0% chance you're going to get it. It's somewhere in there. And why would you roll the dice with yourself, with your family, with the community? And why would you send the message that don't worry about touching stuff that other people have touched if they've got Ebola? He didn't tell people, I think it's safe because so many days have passed, because then that would highlight the tardiness of their response.
Yeah, I mean, it was a PR stunt.
Yeah.
But again, in the case of this second nurse who was infected, she took full precautions. She was wearing the full suit, and yet she got infected anyway. So again, we ask the question, has it mutated? Has it gone airborne, at least to a limited extent? But then there's the flip side of the equation in all this, which is the hysteria. Here we have an article out of CBS News. Officials, airsick passenger on flight from JFK prompts Ebola scare at LAX. A flight from John F. Kennedy International Airport was the center of an investigation in Los Angeles because of a sick passenger. Police at Los Angeles International Airport said a passenger who was showing symptoms of the Ebola virus was being evaluated. Later, they said the passenger was suffering from air sickness. Now, we saw the video earlier out of RT with the Czech passenger being wheeled through the train station covered in a black plastic bag. Turned out that he had a cold. So, David, I mean, we've got people with air sickness and colds that are being treated as potential Ebola patients. And